Today, I also signed an executive directive declaring racism as a public health crisis in Michigan. I want to thank the Michigan Legislative Black Council for their leadership. This pandemic has confirmed and highlighted the deadly nature of these pre-existing inequities caused by systemic racism. COVID-19 is more than 4 times as likely to take the life of a Black Michigander than a white one. And this reflects long-standing, deep societal, economic, and environmental disparities. This executive directive directs MDHHS to work with other state departments to examine data, develop and plan policies, engage, communicate, and advocate for communities of color. Dr. Khaldun will also touch on further steps the department will take to address systemic racism in Michigan. I want to thank Dr. Khaldun for her leadership. She's the reason Michigan was one of the first 3 states to release demographic data so that we could help better act to protect people in our state. DHHS is the largest state department that touches the most citizens in our state, and so her work is crucial, and the work that Director Robert Gordon is doing as well. They'll work around the clock to help us reach our goals. Now, I know how important it is for state government to lead by example, which is why I've directed that all state employees be required to take implicit bias training, including myself and our entire executive office. Implicit bias is simply an unconscious preference that exists in each one of us. And as public servants, we have a duty to understand how those tendencies impact our actions on the lives of others. The training is required for both existing employees and must be completed within 60 days for newly hired employees. This is not alleging that people are racist. It's recognizing that everyone has biases from where we grew up or how we were raised. It's just a fact, and that's why we've got to acknowledge it and seek to address it.